Health Poverty Action, we do work with people without power. We do work with the poorest people, with the most marginalized, with the most vulnerable people in all countries where we work, not only in Cambodia, in all countries, because this is part of our mission. And so the picture that this movie has given is actually a truthful, genuine picture of the situation that we see also in our villages, in our programs. So definitely there is a lot that we can recognize in this movie from our work. The other reason why this movie relates to our programs, to our work, is in a word, I would say, is poverty. The people that you've seen in this story are poor people in the sense that they are suffering from poverty. And when we talk about poverty, maybe for us working in development is almost given for granted, but maybe not for everybody. Poverty is not only economic poverty. When we think about poverty, yes, that is the most immediate thought that we may have. People living with $1 a day or under that line, those are poor people. Yes, definitely, but that is one dimension of poverty. Poverty is made of several dimensions. Poor people, in my view, in our view, are those who, yes, they don't have enough money, enough income, but also those who cannot access education. They cannot have enough and the proper food for them and their children. People who cannot have the right healthcare, the healthcare that they need. Yeah, so in a sense, these people can be the same as the people we work with. The title, I think, of this end of movie talk was Community Strengthening in Cambodia. The reason is that community strengthening is an important, very important component of our work. And the reason for that is precisely because this is our way to tackle, or at least to try to tackle poverty. If we look at these people, we look at people whose rights have been set aside by big powers, let's say, by big economic, big political powers, by all sorts of powers that are overwhelming in their lives. So when we work with communities, it's precisely because we try to empower these communities and give them back a little bit of that power that probably they had in the past. I say they had because my feeling is that the situation today is pretty gloomy. Yeah, if you watch this movie, probably you have shared the same feeling that I had when I watched it the first time. It's a sad movie, quite a gloomy picture of what is going on in Cambodia today. I must say it is also a genuine picture of what is going on. But if we want to do something, if we want to change a bit, try to reverse a bit this trend, our view is that the entry point is precisely the community, is the effort to try and give back some power to these people. When I say again, give back, I think about the issue of food. There was a sentence in particular from one woman in the northern province when she said, yeah, we get sick more and more often probably is the water that we drink and the food that we buy. Cambodia is extremely rich in natural resources. You've seen the jungle at the beginning, the first few pictures. You've seen the land, the soil, how good it is. A lot of water, so a lot of potential, a great potential for food. And on the other hand, we work in projects to increase, or better, to reduce food insecurity, because these people suffer from food insecurity. They have land, that whatever they need, but they end up buying food. So they are no more the owners of their own food. They have, as we say, no more sovereignty over their own food. And that is a big contradiction that we can see when we travel to the field, to our villages. We have these nutrition projects where we support women in particular to provide a good, sufficient diet for their children, with the necessary micronutrients for the children. And we work on these type of activities to increase their capacity to improve the health of the children. And then you always find a small shop at the end of the village selling junk food. And people buy junk food, although they have this type of environment around them. So my feeling is that nowadays people have lost their capacity to actually control their own resources, precisely because there are big powers over them, not letting them express their rights. What do we mean when we say community strengthening? What I said before, for example, we work within the communities, with the members of the communities, to try and address some key areas for their livelihoods and for their health. One important area where we work in is, of course, maternal health. What we do in particular is, as Martin said before, we don't really provide health services. That is not our job. This is not the role that we want to have. Providing health services is something that relates to the government. It's the Minister of Health duty. So what we do is, all right, we try to fill the gaps where there are gaps, but we try to create a link between the communities themselves and the health system. That means that health facilities, health services can be there, but they're not appropriate, or they're not used very often. They're not appropriate because we have seen a lot of what we call indigenous people in this movie. You need to tailor-make your health services to this population if you want this population actually to benefit and to use the services that you provide. We talk a lot about culturally appropriate behavior and culturally appropriate approaches to health. It's incredible to see how big can be this gap between the communities and, let's say, the institutions. When I say institution, I'm not talking about top levels. I'm talking about health facility level. When you have people in the health facility not speaking the same language as the people in the community, you don't create a relationship of trust between the users and the providers of the services. When you have an approach which is not user-friendly, and I should say that in many situations, you have exactly the opposite. You have a situation where people are misrespected and mistreated. Of course, you cannot expect that the health services that are there available are actually used by the population. And then another extremely important aspect to strengthen the capacity of the community is through behavior change. The uptake of the health services is important, but you cannot simply tell people, yes, you have to go to the health facility to deliver your baby. This issue has to be internalized in the community. This issue has to be something that people believe in. And of course, if there are all these barriers that I just mentioned, cultural barrier, linguistical barrier, very often financial barriers, because it is a cost to reach a health facility which is 25 kilometers apart, for example. And then I could list another a good number of other barriers within the community, within the families sometimes. If you don't have this attitude from the community, from the people, you will never reach actually your objective. So people going to the facility, women delivering at the facilities, and in this way reducing dramatically the maternal death rates. So to keep it short, what we do, a simple example of what we do with the community for empowerment and strengthening these communities. We have established in our projects the so-called midwife TBA alliances. TBA stands for traditional birth attendants. So those women, you have probably heard of these people, women in the villages with no medical skills, simply helping other women to deliver. This is what has happened for centuries, I would say. But now what we want to support is the process where the women in the villages actually go and get proper attendance, skilled attendance, so they can deliver safely. This is not going to happen unless you create these relations of trust and you build day after day this trust and this confidence in the services. And so this alliance that I was mentioning, TBA and midwives, has achieved great results in the programs that we have run so far, because we've seen women actually shifting from delivery in the village, delivering in their own homes, and going to the facilities. And the impact is apparent, is evident, and everybody can understand.